Hello and welcome to Chapter 22, Microbial Diseases of the Respiratory System. This morning in my devotional I was reading in Isaiah chapter 40, thinking about God's faithfulness and His grace. In verse 28, really hit me. Have you not known? Have you not heard? The Lord is the everlasting God, the creator of the ends of the earth. He does not faint or grow weary. His understanding is unsearchable. And I think about this and I think about how in studying God's creation, wow, we don't understand how He created everything and why things are the way they are. It's just amazing. Just amazing. I hope you are taking time to do a devotional each morning or evening to read God's Word and to spend time with God. Well, let's talk about the respiratory system and its diseases. This is very timely in what we're going through. Go back and review. Your book has a very nice review of the respiratory system, or you can go to your A&P textbook. But we look at the microbiome. And in the lower respiratory system, usually we do not have any microorganisms, viruses, bacteria, fungus among us. It's just, it should be azenic without any microbiological organisms. The upper respiratory system, you can see, in our nose, throat, mouth, larynx. Here we go. There are lots of different microorganisms, and these help protect our body from pathogens. They can become opportunistic pathogens like Streptococcus pneumoniae, etc. But most of the time, they do a great job of protecting us. So let's look at streptococcal diseases. Most of the time we see this, we think of strep causing a sore throat, pharyngitis, itis, inflammation. Pharyngo is the pharynx. Of course, maybe all of us have had sore throats, maybe all of us have had strep throat, but you run a fever, you don't feel good, your head hurts. Oftentimes, because of the swelling, you can have laryngitis, and if it goes down into the lower respiratory tract, then you can have bronchitis. Some of the complications are scarlet fever, rheumatic fever, and acute glomerulonephritis. So, scarlet fever and rheumatic fever are systemic diseases, and of course acute glomerulonephritis is inflammation of the nephron, the glomerulus, or what we would call a kidney infection. Most of the time, these are caused by Streptococcus pyogenes. Okay, pyo meaning pus. Pyo meaning pus. It has several virulence factors: M protein, hyaluronic acid, streptokinase, C5a peptidase, pyrogenic toxins. Pyro means fire, heat, genic pertaining to the origin or the formation of. So these are the toxins that cause fever. And then streptolysins. So basically, what happens is that we share a drink or straw, or maybe we eat some food, or heaven forbid you kiss someone who has an active strep infection, but you get inoculated. And You can um, also be inoculated by respiratory droplets. Somebody sneezes in your face or coughs, and then you become infected. It can be confused with viral pharyngitis, but as with most gram-positive cocci, penicillin or a penicillin derivative works best. When we look at some of the respiratory diseases, we think about the common cold, which is viral, and there are like 450 different viruses that cause these exact same signs and symptoms. Influenza, once again, a virus. Strep throat, bacterial pneumonia, bronchitis could be either viral or bacterial. Most of the time with bacterial bronchitis, you will run a higher fever. Inhalation anthrax, which we don't see, very rarely see it more in the western states where there's a lot of ranching. And then corona respiratory syndromes. And your book has SARS and MERS, and you might as well just add COVID-19. Okay? So what do you notice here? Cough, cough, sore throat, fever, fever, cough. Here we go. Mucus producing cough. It's what we call a wet cough. If you don't produce mucus, don't cough something up, it's called a dry cough. And then we see in SARS and MERS, coronavirus, when some COVID-19, if someone gets into the deeper respiratory stage, you have a higher fever, okay? A cough, usually a dry cough, and shortness of breath. Notice that some of these have chest discomfort. Some of them we see congestion in the upper respiratory system, and others we may not see congestion. Think about the common cold. We talk about a head cold where there's congestion in the upper respiratory system. A lot of times if I get a head cold, it then moves down into my chest, and we have a chest cold. And then we get over it. One of the diseases I wanted you to be familiar with is diphtheria. And this is caused by Corynebacterium diphtheriae. We see it in animals and in humans. It produces a toxin that causes cellular death. You can diagnose it with sore throat, pain, fever, and then what's called a pseudomembrane. And it's this pseudomembrane that, especially in younger children and babies, can obstruct the airway and they suffocate. We do have a vaccine against this, and no one should ever have to go through this. But you can see here the pseudomembrane. You can see his uvula is very swollen. I don't know if it's a he or she, can't tell. But yeah, this is not good. Should not see this. Here in a smear, you can see the V-shaped and then the palisade. Palisade means like a picket fence. And this is the way Corynebacterium looks like. It's very typical. Notice that they are what? Gram-positive rods. Okay? Oh, that one looks like it's flipping off everybody. Okay, so Let's go ahead and look at some of the upper respiratory diseases. Some of us have had head colds, we've had sinus infections, and nearly all of us have had otitis media, and that is an infection of the middle ear. This is very common in young children, mainly because their eustachian tube is flat. In an adult, eustachian tube is perpendicular, so everything in the ear drains out into the throat. But in babies, it's very flat because their head has not matured. And so what we see is that babies who are given bottles while they're lying down or while they are prone, the milk or the formula or whatever they're given will be sucked back up into their middle ear, and that will cause otitis media. That's why it's very important for babies to be sitting in an upright position or be held in a position where they're more at 45 degrees so that the mother's milk, the formula, the whatever that they're taking in does not flow backwards up into their ears. So that's no fun for little guys. All right, so what do we see about rhinosinusitis? Ew. Inflammation of the nose and the sinuses. Usually we don't feel good. We have a headache, mainly because of all the mucus that's being produced in the sinuses, and that puts pressure and we get a sinus headache. The nasal passages are inflamed, and this can back up into the middle ear. Usually that results in a lot of pain because of the pressure pushing against the tympanic membrane, and it's being pushed into the wrong direction. It's being pushed toward the outer ear, and that is very painful. Okay. So bacteria in the pharynx can spread to the sinuses by the throat, and we diagnose mainly by symptoms. We don't know a way to prevent rhinosinusitis. A lot of people like to use, I think it's called a neti pot, to flush the nasal and sinus cavities with saline solution. That can help reduce the symptoms. If this is bacterial, then an antibiotic. If it's viral, you just have to go with the flow. Okay, now's a good time to pause and stretch a little bit, and we'll come back and talk about the common cold. The common cold, sneezy, runny nose, congestion, sore throat, malaise, and cough. This describes just about everything in the upper respiratory system. These can be caused by enteroviruses, which are also known as rhinoviruses. Entero usually refers to the gut. Rhino refers to the nose. And these replicate at the lower temperature of the nasal cavity. Some people think by inhaling steam, you can help shorten the duration. You have to be very, very careful that you don't damage your nasal tissues. These are viruses. They undergo a lytic cycle, so they kill the cells in which they replicate. And this is looking at the surface of a rhinovirus. Wow. You've probably seen quite a few pictures of the COVID-19 virus. These are highly infected, just like the coronavirus that we're talking about, pandemic we're going through. Coughing, sneezing, fomites, person-to-person contact. Some of us will develop immunity to different serotypes over time, But there are so many different serotypes that, yeah, you become immune to one, and then the next serotype comes along and you catch it. We diagnose with signs and symptoms. Some people take zinc. I'm not sure that does anything. Some people OD on vitamin C. You know, vitamin C is water soluble, and what your body doesn't need, you pee out. So usually staying healthy, well rested, is the best thing you can do. Wash your hands, you know? Are we learning that during this pandemic? Wash your hands. Use hand sanitizer. Oh my goodness. Don't share drinks and utensils and stuff like that with other people. And if someone's sick, don't kiss them. It's so ridiculous. So, why isn't it inappropriate to treat a cold with penicillin, erythromycin, or ciprofloxacin? What do you think? Yeah, you're right. Those are antibiotics. They treat only bacteria. They don't do anything for viruses, fungus, or parasites. So, all right, let's talk about diseases of the lower respiratory system. First, we're going to talk about bacteria. And remember that the lower respiratory system is usually azenic, which means it has no microbiome. And bacterial infections are deadly. Pneumonia. Pneumonia is inflammation of the lung tissue. And when this happens, remember with inflammation comes edema. And if the alveoli are edematous, in other words, they're filled with edema fluid, then that means you can't have exchange of respiratory gases. And if you can't have exchange of respiratory gases, you suffocate. So usually we talk about lobar pneumonia, mycoplasmal pneumonia, and then what's called healthcare associated pneumonia. Lobar means that it's in a particular lobe. Mycoplasmal is caused by the organism Mycoplasma. And then healthcare means it got transmitted to you by someone taking care of you in, could be a hospital, could be a nursing home. Okay, these are the most frequent and serious in adults. One of my physician friends decades ago told me that pneumonia is the elderly's best friend. My uncle passed away this last Monday. He had a massive stroke, followed by a massive heart attack, followed by pneumonia. And pneumonia ended his life, but he couldn't do anything. He was totally paralyzed, and so it was really a blessing. So let's look at the pneumococcal pneumonias. Signs and symptoms: fever, chill, congestion, cough, chest pain. How is this different from a cold? Think about it. What you do see is short, rapid breathing. Because gas exchange is not taking place, the lungs are going to start trying to breathe faster in order to clear out anything. Blood can enter the lungs because of the inflammatory response, and people can cough up this nasty looking sputum. It can be bright red or kind of rusty colored. This is caused by Streptococcus pneumoniae, and its virulence factors are adhesins to help it adhere, capsule to keep it from being phagocytized, and pneumolysine, which license cells. So here we have a picture of Streptococcus pneumoniae. You inhale the bacteria, it replicates and damages the cells in the lung. It has what's called an IgA protease that destroys the mucosal IgA. You diagnose by identifying the bacterium's sputum smears. Of course, penicillin is the drug of choice, and if you are unfortunate enough to get a penicillin-resistant strain, then they have to use a cocktail of drugs. Vancomycin works fairly well. But we have a vaccine, so why not get vaccinated and never have to deal with it? Primary atypical pneumonia our mycoplasma pneumonia, has fever, malaise, sore throat, excessive sweating, may or may not have cough. Oftentimes the cough is dry. Symptoms last for weeks, and it's caused by Mycoplasma pneumoniae. It has an adhesion protein that helps it adhere to the cells, and then it colonizes and kills the epithelial cells. Mucus builds up, and then there's colonization by other bacteria. So this is mycoplasma. Mycoplasma does not have a cell wall, and that makes it difficult to treat and difficult for our bodies to fight. Spread by nasal secretions. Ew. In other words, yeah, don't wipe your nose with your hand, use a tissue. We can treat with erythromycin or doxycycline. Sometimes people who are infected are asymptomatic and they spread it. Does that sound familiar? Klebsiella pneumoniae is caused by the bacteria Klebsiella pneumoniae, a gram-negative, and we all know that gram-negative organisms, this is a rot, are very difficult to treat. Mainly we see bloody sputum, chills, fever. It has a capsule, so it's really hard for the macrophages and neutrophils to phagocytize. We see it more in immunocompromised patients. Basically, you diagnose by finding the Klebsiella bacteria in sputum. You can treat with antimicrobials, but prevention is really good aseptic technique so that a healthcare worker doesn't spread this from person to person. You change gloves in between patients. You wash your hands. You use hand sanitizer. Other pneumonias, Haemophilus influenza, Staphylococcus aureus, Yersinia pestis. This causes the pneumonic plague, which has close to 100% fatality if left untreated. Then we have cysticercosis, chlamydiophila, and chlamydiophila pneumoniae, or chlamydial pneumoniae. These will get you.